more than 15 million babies each year are born before time or prematurely. Unfortunately, many of these little ones do not survive in spite of the best neonatal care that they can get. Today on World Prematurity Awareness Day, I would like to share some tips so that we can work together and avoid this disastrous consequence of pregnancy. I am Dr. Mitali Vasavada, consultant obstetrician and gynecologist, high risk and natural birthing expert. As they say, well begun is half done. So what can you do before you embark on your pregnancy journey so that it becomes relatively risk-free? Most importantly, be in your optimum weight zone. Not overweight, not underweight, just in the right BMI range, which is between 18 to 25. If you are not in this range, make sure you work towards achieving this target weight. Taking care of pre-existing diseases, for example, diabetes, blood pressure, epilepsy, and any medication you are taking for that, make sure it is optimized so that it is not a risky medicine for your pregnancy journey. If you have not been vaccinated, make sure you complete with all your vaccinations, especially rubella, which assumes a lot of importance before planning a pregnancy. If you have any addictions such as smoking or alcohol, make sure that you consider cutting it out, or if you're addicted to any recreational drugs, make sure you are completely weaned off from these harmful drugs. Adequate interval between two births. So if you've already given birth to a child, make sure you time your next pregnancy at least 18 months of the first pregnancy. If you've had a cesarean section in the previous birth, make sure you increase that interval to at least 24 months or 2 years of the last cesarean section in order to minimize the chances and the risk of having a preterm birth or a high-risk birth in this pregnancy. For some reason, if you've had an IVF pregnancy, make sure you discuss with your fertility specialist chances if you can put in one embryo instead of multiple embryos. That is sometimes practiced in certain IVF centers. A single baby is much less at risk of a preterm labor compared to a multiple pregnancy or multiple babies developing at the same time. Of course, if you already are a mother pregnant with twins or triplets, or if you had a history of a preterm labor, make sure you are getting care from a doctor who is experienced in handling such kind of pregnancies, which means that they are a high-risk pregnancy expert who can help you better. What these doctors would normally do is they would assess your risk of getting into a preterm birth in this pregnancy, and they might offer you medication for reducing the risk in the form of injections or tablets, or they might ask you to have a small minor surgical procedure known as a cervical cerclage, which strengthens your cervix and thereby prevents or reduces your chances of having a preterm birth. It's also important that you are aware of the signs and symptoms of an impending preterm birth. These could be chronic lower back pain, excessive vaginal discharge, and crampy lower abdominal pain. Make sure you talk to your doctor if you are experiencing any of these symptoms. It would also be wise to have a vaginal swab testing done so that we know if there is any infection in the vagina that could further impact or cause a preterm birth in this pregnancy. A healthy lifestyle, including a healthy balanced diet, adequate exercise. Yes, my friends, exercising and keeping active will reduce your chances of going into a preterm birth versus bed rest. And very importantly, regular doctor visits. Make sure to visit your doctor at stipulated times given to you by a doctor. In spite of all of this, if for some reason you are in a high risk of having a preterm birth or giving birth prematurely, make sure you talk to your doctor about giving you antenatal prophylaxis steroids, which come in 2 doses after your 7th month or sometimes even after your 6th month or 24 to 28 weeks as deemed suitable by your doctor and you. This will reduce the risk of your baby, if delivered prematurely, of 3 major problems that premature babies face. Firstly, problems with respiration, lung issues. The second problem, necrotizing enterocolitis, and the third problem being intraventricular hemorrhage or bleeding inside the brain. Make sure that you're well informed, make sure that you're aware, so that we can all work together and reduce the risk of this common but easy to prevent complication of pregnancy. I hope you all a risk-free, full-term delivery and a happy pregnancy. Thank you.